The Nigerian Association of Resident Doctors (Nard) on Friday agreed with the government to end their ongoing strike. Nard embarked on strike on 31st March 2021 due to non-payment and non-recruitment of house officers, abolishment of the bench fees, non-payment of national minimum wage consequential adjustment arrears, residency training and hazard allowances, and payment of resident doctors on Government Integrated Financial Management Information System platform. However, these issues tabled by Nard were resolved and agreement reached during a 9-hour conciliation meeting with the Minister of Labour and other key agencies on Friday. At the meeting, a Memorandum of Action (MOL) was agreed and signed by both parties, which led to the agreement of the striking doctors to end the strike. The Minister of Labour and Employment, Dr. Chris Ngige, who headed the meeting, stated that it was discovered that payments of the house officers' salaries experienced irregularities as double payments were made to some house officers and some centers, and few have not received their payments. According to him, a 5-man committee was set up to harmonize the list of the names submitted by Nard chairman and committee of chief medical directors within 72 hours.
The meeting noted that there were some irregularities, minor though, because 90% of the house officers have been effectively dealt with. So a 5-man committee has been set up there to work and smoothen the rough edges as per those affected in the irregularities we mentioned, which is issues of double payments to some places and centers that have received before that are not being owed. So they have to marry the situation and regularize it.
The minister said that 558 people who were not resident doctors were wrongly paid, and bona fide 1,003 resident doctors were not paid, adding that those who were not paid will be captured in the supplementary budget. Outlining the agreements on the Memorandum of Action, the minister said every relevant agencies must work within the stipulated timeline.
The residency training allowance payment done in 2020 for the period January 1, 2020 to December 2020. This is for residents in training in Part 1 and Part 2 who are going for examinations. There were allowances that are paid, and the examination fees also paid to their respective colleges. So that in the one of 2020, a total of 558 non-residents were paid in error, leaving out 1,003 residents who are eligible for payment. So the meeting agreed that the 558 persons will refund what they have collected that is not due to them. We also gave timeline for all this, and we say that they should conclude all within 3 weeks. In view of all these understandings, the meeting asked Nard National Officers Committee (NOC) to consult urgently with our Executive Council with a view to giving this conciliation process a chance for industrial peace, for the care of our patients, by calling off this strike embarked since 1st of April 2021.
The President, Nigerian Association of Resident Doctors, Dr. Okaiyesui Oyulawa, at the meeting stated that the signed Memorandum of Action will be taken to the union and promised that the strike will be called off soon. The General Secretary of Nigerian Medical Association, Eba Philip, pleaded with the Minister of Labour and Employment to use his good offices to fasten the implementation of the MOA.
We have had a very fruitful deliberation, and me and the National Officers Committee will take this back to our members with the hope of calling off the strike.
They are virtually satisfied with the agreements reached so far, the timelines reached so far. Our appeal, particularly to the Honorable Minister of Labour and Employment, to still use his capacity to fast forward and make sure that these timelines are met.
The Nigerian Association of Resident Doctors was satisfied with the agreement, and the strike will likely end as promised by the association. Chibueze Obi, Signature TV, Abuja.